Today we will be discussing something about one of the commonest conditions which see in our day-to-day practice, that is migraine headaches. Migraine is the second commonest cause of headache after something called a stress headache. What exactly is migraine headache? Usually it's a unilateral headache associated with a feeling of nausea or vomiting, which usually lasts for more than 30 minutes. Sometimes it can last until 4 hours and sometimes until 48 hours as well. Sometimes patients have to take medications until then they will get these headaches. It's a very severe type of throbbing headache. So what are all the common triggers for migraine headaches? The commonest reason being dehydration. Next comes the hormonal changes which happens in pregnancy or during menstrual cycle. Sometimes strong odors can induce these headaches. Lack of sleep, stress and anxiety, bright lights and loud noises can induce these headaches. Sometimes there are some food items those can induce these migraine headaches. We'll discuss those things in the preventive measures. So we'll discuss something about women and migraine. So migraine is more common in women when compared to men. In the beginning, the incidence of migraine increases at the time of puberty, and in the whole period cycle, the frequency and incidence of headache increases during the migraine menstrual cycle. And during pregnancy, two-thirds of the patients will have decrease in the attack of migraine headaches. And during menopause to post-menopause, the chances of getting migraine headache drastically comes down. But during the perimenopausal phase, the attacks can increase because of the fluctuations in the level of estrogen and progesterone. So what are all the management tips to decrease the frequency and intensity of migraine? First, we need to know what are all the triggers which induce migraine headaches. Each individual has different triggers, so we have to hydrate ourselves well. At least 3.5 liters of water per day is mandatory. Regular exercise, aerobics, pranayama, yoga, Surya Namaskaram can help you. Drink plenty of water. Avoid skipping food. You need to fix your timings. Adequate 7 to 8 hours of sleep is mandatory for migraine patients. You have to skip smoking. And whenever you are going to sunlight, try to use sunglasses. If you are into loud noises, try to use earbuds and try to cut down on your screen time. Don't use mobiles at night by putting off all the lights. And there are some food items which you need to avoid if you have migraine headaches, like tea which contains tannin can induce your migraines, caffeine in coffee, the cocoa in chocolates, the cheese. Chinese foods, usually they add mayonnaise sauce in that which contains monosodium glutamate. Alcohol can induce migraine headaches, and any preserved foods can have some additives. Preservatives can induce migraine headaches. So these all food items you need to cut down as much as possible.